Now, moving on to our first section, that is the stress fractures. What are stress fractures? And we'll be discussing it, their definition, their types, what are the sites which are the mainly bone which get affected by the stress fractures, and what are its treatment. So what are stress fractures? Or what are their another name for the stress fractures is actually the fatigue fractures. Fractures occurring in a normal bone of a healthy patient due not to any specific traumatic incident but to small repetitive stresses. For example, if the patient usually the classical example is of army personnel. The marchers they usually due to they have a classical presentation of tibial pain, leg pain, and which usually results in stress fractures. Why? Because their mechanism of action is such that there is a repetitive micro trauma which is occurring at the same place, leading to a stress fracture. There's no actually history, a detailed history of incident of a trauma, which may be a low energy or a high energy trauma, which may result in any kind of a fracture. So usually, initially, the X-ray may be very much normal, and once after we review an X-ray, after some time, we may be seeing a healing callus over there. If you see this, there is a healing callus over there, which was actually a telltale sign that there was some kind of fracture which is now in the process of healing. Sometimes the X-ray may be totally normal, for example, but then eventually a MRI and bone scans may be showing some differences. So stress fracture is actually due to micro trauma without any incident of any trauma. There are two main types. One is called as a bending type, and another is a compression type. Now, bending type is usually in a bone which is the loading is such from the force is acting from one side, and the compression type is such in which the load is actually occurring from the two sides and leading to a compression type of a stress fracture. So coming to the different types, what is a bending stress is actually causes the deformation. Repeated stress or leading to osteoclastic resorption exceeds osteoblastic formation. Then there is a zone of relative weakness which develops because osteoclast are resorbing bone and osteoclast are not forming bone. So the bone is actually getting weaker day by day, where there will be a time will come in which there will be a micro fracture over present at that time. And eventually this will present as a pain, and X-ray may show very slight amount of changes, or initially X-ray may be totally normal, and probably the patient will complain of pain most of the time. Coming to the compressive stresses, usually on a soft cancellous bone, such as, for example, calcaneum, maybe around the areas where the cancellous bone is present, and usually frequent repetition and impacted fracture it can be appreciated at that time. Now, sometimes the combination of stress fractures could be of both types. There could be compression and shearing stresses, which may lead to spontaneous fractures at times. But usually the history is subtle. There is no massive history of trauma and even of low energy or long energy, and but you can appreciate there is probably micro trauma due to repetitive loading or a stress over a certain part of the bone. What are the sites which usually get affected? There are multiple areas in body which can get affected from stress fracture. The most common is actually the shaft of humerus, especially in the laborers who are doing some drilling work in which they have to hold that machine which is doing the drilling. That is actually the stress is coming onto the bones most of the time. Other is pars integralaris of the fifth lumbar vertebra. This may be due to weak bones as the osteoporosis sets in. This may be due to patients, those people who are actually lifting heavy weights may suffer from this kind of a fracture. Other is pubic rami of the femoral neck. This may also be very common. Femoral shaft, rare, but yes. Tibial shaft, most common in armed forces personnel. Distal shaft of the fibula is also one of the side, although rare, but yes, there is stress fractures can occur. Calcaneum usually in adults. Navicular, classically stress fracture of navicular is in athletes because they're running around during the naviculum. The tibialis posterior is actually attached on the naviculum, and that is where the most pull occurs during the loading. Therefore, that is during running and jumping. Therefore, stress fracture is very common in athletes. And other usually in armed forces personnel, the stress fracture metatarsal is also very common, especially in the marchers. Now coming to the imaging, in any orthopedic abnormality, the first and foremost imaging is usually the X-rays. Sometimes the X-ray may be totally normal. Sometimes the X-ray may show very subtle signs, which include X-rays may reduced scintigraphy will show an increased uptake. There may be appearance mistaken for osteosarcoma because there may be a calcified slightly. Ischemic necrosis of the detached fragment may be very much visible, but that is when an advanced stage has reached. Initially, the X-rays may be totally normal. Compression stress fractures usually show a sclerosis band with peripheral callus. When you are viewing a callus which has already formed, this means there, and retrospectively we can conclude that probably there was a fracture present at that time, which is now in the healing process. So that means initially, if the X-ray was done, this would be typically normal. So what is the ideal treatment to rule out the stress fractures, or when we are suspecting stress fractures? That is the MRI. Now, what would we see on MRI? We would see spontaneous undisplaced osteoarticular fractures in patients, especially in the patients with sudden onset of the pain. And usually pain over the anatomic anterior medial part of the knee is very common, and if that is, we get an MRI, that is usually shows underlying a stress fracture over there. If you see this here, there's probably a stress fracture in the calcaneum. There will be definitely edema and increased uptake over this area, especially in the case of bone scan. Now coming to the treatment. Initial treatment starts with an elastic bandage, which probably need some kind of a support and splintage. That is, the first and foremost is avoidance of the painful activity, which is actually causing we have to prevent the repetitive stress, which is causing the micro trauma. If it's femoral neck which is involved, sometimes femoral neck cannot be treated conservatively because there is very high risk of this developing into a complete femur fracture and eventually leading to avascular necrosis. So that has to be internally fixed with screws, and sometimes prophylactically they have to be fixed with screws because when we are suspecting femoral neck fractures. In this section, we have briefly gone to what are stress fractures, and they're usually not due to there is no incident of trauma, but there is actually repetitive stress and loading of the bone due to micro trauma. This results in a stress fracture. Initially, the X-ray may be completely normal, but later on, X-ray may show a subtle callus formation, and usually hypertrophic callus is indicative that there was a fracture probably which is now in the healing phase. Ideal treatment is actually ideal diagnosis is done by MRI, which would show osteoarticular fragment, increase edema over there, and increase uptake. If we do the bone scan usually shows increased uptake due to and shows a hot area. Treatment is actually avoidance of the painful repetitive activity, rest, splintage, and analgesics. Thank you very much. Keep watching sqadia.com.